Welcome back to Plant and Animal Diseases class, and in this section, Unit 14, Metabolic and Deficiency Diseases, we're going to be discussing a lot of different examples of diseases related mostly to nutritional type problems, but also associated with stressors along the way. So let's get going and talk about some of the diseases in this unit. The first one is called milk fever. We also know it by several other names. One of them is hypocalcemia, which means low in. That's the hypo part. Calcemia is blood calcium. So low in blood calcium. Parturient paresis is the technical or veterinary term for this particular disease. And kind of the old farmer term is called Downer cow syndrome. But the fever part of milk fever is a misnomer because there is absolutely no body temperature or elevated body temperature associated with this particular disease. In fact, if you've ever tempted a cow that has symptoms of milk fever, she'll actually be just a tick below normal body temperature. It affects all the animals that are listed here at the bottom of the slide, whether it's dairy all the way to. It's caused by an acute deficiency in blood calcium, and we'll talk about some of the reasons for that here in the following slides. But what happens whenever we have low blood calcium, the resulting effects is we have a kind of, first off, paralysis. That animal will go down and have difficulty, if not impossibility, of standing up, just can't support themselves. Then we'll have circulatory system collapse, eventually leading to coma, and if left untreated, death. And it runs at about a 6% incidence rate in dairy cattle, quite a bit lower than that in beef cattle, a little bit higher than beef cattle and sheep, and a little bit lower than sheep is goats. So most of the time you'll see this occur within 24 hours after calving or birthing, lambing, whatever it might be. But it can happen a little bit later than that as well. One of the things that you'll find as you come up on a cow that has Downer cow syndrome or milk fever, that cow will be laying down, and lots of times their head tucked around to their side. And if you reach down and feel their ears, very often their ears are a little bit cold to the touch, which is not normal. So, but what they do is they start shutting down the extremities, blood flow to the extremities, trying to save the internal organs as this acute deficiency of calcium. So the incidence rates tend to increase when we talk about milk production and age of animals, and then we have some different susceptibilities between breeds. For example, Jerseys are much more susceptible to milk fever than, say, Brown Swiss or Holsteins and things of that nature. Really, when we look at the biggest problem related to milk fever or hypocalcemia, it's the subclinical rates that affect about half of dairy cows. That's a major challenge among dairymen and even those raising sheep out there, is the subclinical effects of hypocalcemia. Subclinical being we can't really see the symptoms, but they are there affecting the animal negatively. So lots of times that leads to some of the things that are listed down here at the bottom of the slide: decreased dry matter intakes, low blood ketosis, or low blood sugar, which is ketosis, retained placentas is RPs, displaced abomasums you've heard about before, or DAs, leading to a lot of inefficiencies in reproduction. You have trouble getting her bred whenever first few breeding services come around, and even decreased milk production in that lactation all the way through as she gets off to a slow start. So you'll find a lot of those different things, that subclinical hypocalcemia, that lots of producers are trying to target and eliminate in their fresh cattle. It's pretty rare in beef cattle, and part of that is you just don't see the extremely high rates of milk production that come along right after calving. So that's a challenge that sometimes occurs. And in goats, it's very similar incidence rate to dairy, even though you'll find some varying different numbers out there related to these in the industry. The cause, again, initiation of lactation causes a severe outflow of calcium. So whenever a lamb or a ewe lambs or a goat has kids or a cow calves, is we go from a very low calcium need to extremely high calcium need within a few hours. And so the animal has trouble mobilizing enough calcium to meet that need. And where they're mobilizing it out of is in the blood system there somewhere. So calcium interacts in addition with a lot of other minerals in the blood. So whenever we have a lot of different things going on and changes in pH in the blood, then sometimes we can have calcium flows blocked or kept down just because of some of the other balances of minerals like magnesium, potassium, phosphorus, even estrogen in the blood that might cause issues out there. So one would think that in order to slow this down post-calving is we should feed more calcium prior to calving, and that oftentimes is a very bad idea because it will actually cause milk fever to occur. Because what happens is that animal or the cow in this example really doesn't adapt to beginning to mobilize its own calcium reserves. So think about a pump that you don't prime before you start it up. That pump is rather inefficient at pumping water out of a sump hole or something like that until you prime it and get it full of water. And that's the same kind of thing that happens when we talk about milk fever in animals, is that pump, so to speak, that metaphorical pump, does not pump calcium out of the bones very efficiently unless we depress or decrease the pre-calving calcium feeding rates so that she'll start to do that automatically, because simply she can't eat enough calcium to meet calcium need right at calving time. So let's move on to the clinical signs. When we see stage 1 milk fever, and all of you that have any animals that may be susceptible to this at home should pay very close attention here if you're not already pretty up to speed on what milk fever looks like. Stage 1, you find animals that are a little hypertensive, meaning they're kind of a little bit depressed or weak, a little anorexic, or even hypersensitive, meaning they're kind of jumpy. That's stage 1 clinical signs, and probably most of the animals out there that exhibit subclinical symptoms of milk fever, if you went and checked them, they're in stage 1 of milk fever. Stage 2, now we see some flaccid paralysis. They may just be laying down, very depressed. You may find them shake. That's the small muscle tremors. Think about you're shivering when you're cold. There's a lot of different things that can happen stage 2, but at this point in time, if we use a cow for an example, she's laying down, usually laying down hopefully upright with that head tucked around to her side. But again, if you reach down and touch the ears on this cow, they're going to be cold to the touch. Stage 3, then that cow then no longer has the ability to support herself upright. She'll probably be laying flat on her side, head stretched out, and is comatose at that point in time and approaching death. So how do we treat this particular problem? And the good news is it's very, very treatable, and especially when we catch it early, they respond very, very quickly. So in stage 1, we can come in with some oral or even IV calcium salts, that an oral type gel. Think about a tube of gel that we kind of put down their throat, and that will absorb into the blood in about 15 minutes. So then, in about that time, that cow actually should get right up and get moving. An oral treatment, if you go orally like one of those gels, generally gives us a much higher calcium dose. There's some mixed reviews on some of the products out there, which ones are most effective and which ones are a little bit hard on them and caustic. So keep in mind what you might use. But one of the things with a longer lasting type and a higher dose with regard to these gels is it may help prevent a relapse, because they can relapse here in 6 to 12 hours depending on how bad the problem is. When we talk about stages 2 and 3 of milk fever, here we're really needing to go with an intravenous calcium salts application or treatment. And this, if you're trained in it by your veterinarian, you can do this on your own And if you're not confident, then get your veterinarian out there. But you need to get at it pretty quickly. Once that cow is down, like we mentioned in stage 2 in the last slide, really intravenous calcium is your best option at that point in time. And you want to make sure that you administer these particular medications, this particular mineral, very slowly, and stretch it out over a period of 5 to 10 minutes, and mostly stretch it towards 10 or more than that, even if you can. So let's think for a moment that we've got a cow laying down at her, there at her side. We're trying to help her out. We insert the needle into the jugular vein, run our IV tube, and we've got our bottle of calcium, 500 ml bottle of calcium salts that we're ready to put in her. We want to hold that bottle actually very down close to the animal's body so it drips kind of slowly into the blood system. What happens whenever you try and run it too fast is actually it can cause heart attack and cause the animal to die right there in your hands, so to speak. So you want to make sure and administer that slowly. I've also seen farmers and veterinarians mix that calcium salts maybe with a bottle of dextrose or something like that in order to dilute it if they want to run it a tick faster. But the best idea at this point is take your time. Know that you need to spend time there by the animal's side treating her, and she should respond most of the time very, very quickly. Again, I've seen many animals over the years that have stage 2 milk fever. You give them a bottle of calcium. By the time that you get the IV tube cleaned and put away and the bottle thrown away, that cow is up and moving around. Now, she may not go right to the feed bunk and eat right away, but more than likely she's going to get up. And if she doesn't, she's probably going to require some subsequent treatments. So within 30 minutes of treatment, that animal should be standing. In a best case scenarios, they get to the feed bunk and start eating. Prevention of this particular disease, simply a good nutritional management practice in the pre-parturient or dry period prior to calving. Low nutrition in terms of calcium, low levels of calcium in that diet in order to help prime the pump that we talked about early on. Maybe acidification of the diet, so feeding a lot of anions prior to calving in the diet will also slow down these milk fever incidence rates. So make sure and keep contact with your veterinarian if you're experiencing some of these difficulties to help prevent that. There's a lot of producers that have a whole protocol right at calving time that they give them a lot of different products and medications to try and help prevent this right at calving time or the first couple days. So, again, speak with your veterinarian whether you're using that as a preventative agent or a treatment for subclinical issues. Moving on to the next disease is ketosis, and this occurs in all gestating or lactating cattle. It occurs in sheep, it occurs in goats. So we talk about ketosis, and it generally happens within the first 6 weeks after the parturition process, and very often affects first calf heifers, sometimes older cows, but very often first calf heifers. What's going on here is we're mobilizing so much fat off the body that excessive amounts of what we call ketone bodies are found in the urine. They'll be excreted in the blood or the milk as well. And so we also know this particular disease as acetonemia or hypoglycemia. Again, low in blood sugar is hypoglycemia. And that acetonemia is actually, you can smell it on their breath, that acetone smell. It's somewhat of a sweet smell on the breath of these particular animals that have it. And good herdsmen actually can walk through the barn and detect that it's in the air, and then just by sniffing around they can start to pick out the animals that have ketosis right away. Very similar to pregnancy disease in ewes. I mentioned that it happens to sheep as well, and that's the same type of thing. But what is the cause of this is characterized by very low blood sugar. So think about again, right after calving, we've started to increase milk production at a rapidly ascending rate. And so again, the animal just can't consume enough energy and carbohydrates in order to meet that need, so they begin to pull body fat off of their back. Whenever that rate happens at too high, too fast of a rate, then it causes the liver to produce these ketone bodies, which then decreases the animal's appetite. And as the animal's appetite decreases, then she mobilizes more fat in order to meet milk production needs. And as that happens, then she produces more ketone bodies, which decreases her appetite even further. So it's somewhat of a... Sometimes an animal can handle this for brief periods, and some of it may be even considered a tad bit normal. But excessive time spent maximizing their own body fat reserves results in what we call ketosis here. And so when we talk about body weight loss from parturition time on, that animal should not lose more than, let's say, 10 to 15% of her body weight if you want to avoid ketosis problems like this. The way to detect whether an animal actually has clinical ketosis is use what we call a keto stick. And what you do is you get the animal to urinate on this little piece of paper that's got a reactor on the end of it, and you just simply dip that keto stick, that piece of paper, in the urine, and depending on the amount of ketones that are being developed or dropped into the urine, they'll react with that piece of paper, and it'll turn anywhere from a very pale color purple all the way to a very, very dark purple. And the darker that turns, the higher ketones that are in the blood. So it's a very easy way to actually test for this. Clinical symptoms: extremely rapid weight loss and loss of appetite. I mentioned that acetone smell, and there's a little bit of nervousness. So how do we prevent it? Again, manage your pre-parturition nutrition program, so avoid excessively fat cows or fat ewes prior to parturition. Increase concentrate levels gradually after calving, so a good time to add some fiber to the diet and make the ration as energy dense as what you can. Not a time to make big ration changes, or especially big forage ration changes. And a good time to feed some high quality hay and maybe even a little bit of free choice hay to these particular animals. Really focus on cow comfort here. Good temperature in the barn, clean fresh bedding, and good ventilation. We want to avoid any other stressors that may keep her from getting up and eating, getting to the feed bunk, picking at that hay that you may have provided out there. But really focus on cow comfort, because much of this is you can feed up to about 4 ounces of propylene glycol, which is a sugar water type product, and that will help mobilize sugar into the blood so that we decrease ketone bodies. And then a little bit of higher grain content in the ration prior to calving, and that effect is about somewhere about 3 weeks is a great time to kind of slowly add a little bit more grain, a little bit more carbohydrate to that diet prior to calving or prior to parturition, just to help add a little bit of energy to the diet, get them used to it a little bit. But you, again, don't want to go crazy so that they gain weight in those last, let's say, 3 weeks. Treatment: about 0.5 to 1 pound of propylene glycol or sodium propionate daily, and that should go for about 5 to 10 days if you've got an animal that's experiencing ketosis. So you need long-term treatment. Just a 1-day treatment of that propylene glycol solution probably won't do it, and that's provided as a drench. So you actually snake a tube down the animal's throat and pump it down her throat. And again, there's a number of things that you have to be concerned about there, so make sure that you either have a veterinarian do that or consult with him or her before you go about doing that. Intravenous glucose or dextrose solution can also help if you have severe problems. Again, sheep and goats, there's a different little treatment protocol for them then. But then do not exceed 8 ounces of glycol in a treatment. So what it does is actually mimics the symptoms of milk fever, and it increases the severity of ketosis. They will actually really go crazy the opposite way, mobilizing ketones. So you don't want to don't use the some is good, more is better treatment philosophy here. Do not exceed 8 ounces, because that is really all that they can handle. You'll actually cause more problems than you'll fix by going overboard on treatment here. Next disease that we'll discuss is what we call grass tetany, and this one is associated with animals that are spending a lot of time grazing on pasture, and especially lush pasture. So think springtime here, whenever that grass, new grass is coming on nice and early and lush, and it looks nice and tasty, and your cattle can't wait to get out and graze on it. And what this is hypomagnesia, so low in blood magnesium, and sometimes it's actually accompanied by hypocalcemia that we discussed earlier in this section, which is milk fever, of course. So whenever we have high levels of nitrogen and high levels of potassium out in your soils and out in your grass, those things actually combine to inhibit magnesium absorption in the blood. That's why sometimes even with proper fertilization of our pastures, you can actually have that magnesium bound up so that it will not be absorbed in the gut. The cause is it's pretty common in pastures early in the spring, and we're talking about the first maybe 2 animals. But it can occur later in the season, whether we have specific weather conditions or simply low magnesium soils. The other thing that can happen is if we overgraze one paddock or field, then move to a really lush new field of grass, and the animals consume a whole bunch of it right away, sometimes that will bring on the onset of this one. And there's some stressors that can cause grass tetany as well. Clinical symptoms on acute cases is we see really rapid losses or drops in blood magnesium levels, and you can find even sudden death here, but lots of times drastic behavioral changes. Stagger or run blindly or have convulsions or do what they call stargazing, which is kind of stand and stare at the sky with their head kind of swaying left and right. Kind of some funny things whenever we look at grass tetany come along. So don't just assume that cow is just acting weird. There may actually be a reason behind it, especially if you're out on lush pasture. Less acute cases will have some maybe kind of drunken gait or incoordination, loss of appetite, muscle spasms as it's listed here, and some of these things occur about 6 to 10 hours from the first symptoms to death if we leave this untreated. So if we talk about things that can cause severe onset and death pretty quickly, this ranks right up there with some of those types of problems. And if we let an animal get to the comatose state in grass tetany, there's very little chance of recovery, even going with intravenous magnesium treatments. So how do we prevent it? Again, supplemental magnesium is a great idea in your mineral program. A little bit of crash feeding magnesium after disease really doesn't help. So start that feeding prior to the calving or parturition period and keep that magnesium level adequate. So gives you some recommendations here on the slide. So make sure that you have a good nutritional program. Treatment, if you see this, I would suggest just simply calling the vet immediately. This is a less common disease, especially in our area here in Southern Illinois, as compared to milk fever and ketosis. So I would suggest get your veterinarian on the line and headed to the farm as quickly as possible, because success in recovery is limited after about 8 to 12 hours of this particular disease. 200 cc's of Epsom salts or magnesium sulfate subcutaneous injection is a lot of times what a veterinarian will suggest in this example. And then intravenous magnesium calcium solution, again administered slowly, because we can have the same heart failure type problem that I described earlier. Oral administration, like we considered when we were talking about milk fever, if you have an animal that is clinically ill here, time is of the essence, so it's probably not worth doing an oral administration because time of absorption into the blood is slow enough that you'll probably not get recovery fast enough. So make sure that you have a good plan with your veterinarian if you have this particular problem. Get that animal right off the pasture that's causing the issue, and again, supplement them, feed them separately, because there's a pretty high likelihood that grass tetany cases will repeat. The next disease here is even more rare, and that's what we call white muscle disease, that occurs mainly in young animals, and it's more common in areas where soils are low in selenium content, and that's not really associated that often with southern Illinois here. So this is an even more rare disease in this area. So we're talking about selenium deficiencies here, about less than 0.02 parts per million selenium intake per day. That's just a very few milligrams of this per day. Clinical signs, you can see actually the acute form causes basically sudden death, which that's fairly uncommon. But the subclinical form is much more common when you talk about places that do have this, and they'll look and act kind of unthrifty, which means rough hair coated, kind of don't get along very good, kind of stand back and away from the pack, kind of look like skinny in certain spots, be a little bit stiff, or even if they're down, they really won't want to stand that much. But there's no real fever or loss of appetite here going on with white muscle disease. But what's going on is much higher effectiveness in the muscle itself. Pigs, you'll see a lot of different things here, but when you look at the post-mortem examination, is you'll actually find pale white streaks in the skeletal muscle tissue. Actually, that the muscle will kind of turn white and real fibrous instead of flexible and stretchy. It'll become real fibrous and painful for that animal, which actually it can occur all the way into the heart muscle if left untreated. So prevention, make sure that we're feeding adequate amounts of selenium and vitamin E. The legal limit on supplementation is 0.3 parts per million. You don't want to get any higher than that in your rations, because that's not allowed. You can also get boosters of selenium prior to parturition. That's I know several farmers that's one of their protocols is they give some injections of selenium and vitamin E prior to calving or prior to parturition in order to help prevent this particular disease. If you go something more specific, you probably need to get your veterinarian involved here. There's some withdrawal times associated with this. When you talk about the next disease coming along here, it's hypoglycemia in newborn pigs. Not exactly the same thing as ketosis earlier, but it's similar in effect and what it's caused by low blood levels. So basically, you have a pig that has an inability to manufacture or use glucose on their own the first few days. So, or maybe an abnormality in the colostrum. Agalactia that's listed there next is actually a problem with mother sow, that she actually does not make any milk, or dysgalactia, which would be abnormal milk. So you also have this that occurs in weak pigs, kind of the runts of the litter, so to speak, that get pushed back from nursing. So basically, you have lots of things here that could cause this particular disease, where they, lack the ability to. Clinical signs, you'll see a lot of things here listed on the slide, but those animals will shiver, and what that shivering effect is they're mobilizing and burning body fat in order to convert that to energy. And babies are born with what we call brown fat, and that's baby pigs, humans, calves, basically all species are born with a little bit of what we call brown fat, and that's a little body reserve that they've built up that they can call upon if need be, right in early stages of life. If they're not getting enough to eat, they will burn that brown fat. But once it's gone, they don't have much else to call upon and mobilize of their own in order to meet energy needs. So once that's what some of the effect is here in this particular problem. So how do we prevent it? Eliminate sows, cull them from the herd if they're prone to MMA. That's a disease that we discussed, I think, earlier in this class. Mastitis, metritis, and agalactia in pigs. If you have sows that are prone to that particular problem, it's probably a good idea to get them on the truck and get them off the farm, because they're going to cause problems with your sow litters. Proper nutrition of that sow prior to farrowing obviously will help help that sow transition and help those baby pigs as she's nursing that litter of baby pigs. Whenever you're clipping needle teeth, be careful not to damage the mouth, because if that pig doesn't feel like, if he's got sores in there and doesn't feel like nursing, that will bring on this particular problem. And then sows that have low milk production, you need to be in there getting ready to help those baby pigs along, whether it's cross-fostering them with another sow, feeding milk replacer, and or giving some intramuscular injections of glucose every, let's say, 6. Treatment, again, is supplemental feeding, improving the environment to eliminate stress, and again, I mentioned the glucose injections. So let's transition to another disease in swine, and that's parakeratosis. Really a strange disease in pigs. An elephant hide appearance develops in feeder pigs, and this is caused by actually a zinc deficiency coupled with excess calcium supplementation. So you already can tell we're feeding too much calcium and not enough zinc, and you have a whole lot of bad from that. So clinical symptoms, this occurs generally in pigs in confinement during fall or winter time, and pigs between 7 and 20 weeks of age. So because we've got this mineral imbalance of two of them here, the skin becomes really dry and crusty, and that crust really kind of thickens, maybe causes kind of a callus experience there. Spreads to the underline, the sides, all around the jowl or the jaw and the ears, and it generally follows or forms rather symmetrically. So if whatever you see developing on the left side is also on the right. It's different than mange. If you've ever seen mange on a dog or a pig, that kind of forms in splotches with the mites that cause that. This one will be very symmetric in nature. So actually, as that parakeratosis develops, then you'll see some of those parts as they dry and crack, they'll become bloody or infected, and actually you'll see them slough off that skin as they drop pieces of skin off. Prevention, again, proper feeding rates of calcium and zinc, keep those in proper balance, and then add addition of a little bit of fat to the diet will also help kind of moisten the skin so that they don't have this particular problem. Some take-home messages to this section. Again, managing metabolic diseases is pretty carefully done through proper nutrition, but don't forget that facilities is extremely important. Animals that can't eat properly, especially through the transitional time, and cow comfort or animal comfort is really important through this, through a lot of these particular diseases, and getting animals off to a good start after parturition, which is what a lot of these diseases in this section were associated with. Well, oftentimes these are, again, nutritional in nature. Stressors bring these things to the forefront. Whether it's temperature stress, whether it's environmental stress, whether it's not enough water. There's a lot of different things that can magnify things like ketosis or milk fever, or a lot of the diseases we discussed in this particular section. Bottom line is, all of these are very expensive and require regular and expensive medication, and oftentimes, as you saw through the unit here, many days worth of medication in order to support and help recover that animal if you keep it from dying on you, or keep it from killing off other animals like your baby pigs like we just discussed. So make sure that you have a game plan for these particular diseases on your farm, because they can be quite costly and take a long time to recover that expense, if at all, during that lactation. So that takes us to the end here of Unit 14. Hopefully that will help you with your assessment related to this particular topic here. I'd invite you to stop by if you have any questions, but good luck on your assessment, and we'll be signing off here. Unit 14.